Let me teach you everything you need to know about infusing blood products. If you're a nurse working in a hospital, chances are you have probably infused quite a bit of blood products. And hospitals are very specific in their policies and procedures for administering blood products. And so, even though I'm going to talk about a lot of the general stuff here, make sure you're still following your hospital's policies. Before we ever even get the blood products in our hand, a couple things need to happen. First, we need to get consent from the patient or from their next of kin medical power of attorney. The only time you would not get consent is if this is an emergency and we do not have anyone to consent, and then this is a life or death situation. The next thing you're going to want to do is draw a blood sample to send down to the lab or to your blood bank in order to cross match blood products to whatever the patient's blood type is. The type and screen blood sample that you draw is typically good for about 72 hours. And so you're able to use that sample for about 3 days to match any blood products that the patient may need. Again, if this is an emergency, you don't got time to do this. And so we are going to infuse uncross matched blood into the patient, and it just puts the patient more at risk for transfusion reactions. However, sometimes in a life or death situation, you would take a transfusion reaction over death. And so we'll usually infuse O negative blood. Once you've gotten consent and you've drawn that lab sample, sent it down to the lab, and it comes back and it tells you the patient's blood type and all that, then you can order blood products for the patient to be administered. The blood bank will get your order and they will begin looking at what the patient's lab sample says, what blood type do they have, do they have any antibodies or different things in their blood sample, and then they will also take a look at the blood products they have available to match up what would be the best product for that patient to receive. At my hospital, the blood bank will call us and let us know, hey, your 2 units of blood are ready. That's when we know when to request the blood, but I'm sure every hospital's process is slightly different. When you get the blood products in your hand, you're going to have to do a couple more things before you go ahead and start it. First thing is you're going to want to have a recent set of vitals, including temperature. Next thing is you're going to want to verify the blood product with another registered nurse or somebody that is able to verify blood products with you. You're going to be looking at the product number, the product type, if there's any special things about the product, like is it leukoreduced, is it irradiated? You're going to be looking at when it expires, and you're going to be comparing this to the patient's blood band that they have on their wrist from when you took that blood sample. And you're going to want to make sure it is a match, meaning your O negative patient should not be receiving O positive blood. Once you have verified all of those things, you have consent, everything's checked off, 2 nurses have witnessed and verified blood together, then you're going to go ahead and set it up and prime it. Your standard blood tubing looks like this right here, this Y tubing where you can prime one side with normal saline through the whole thing, and then you can connect the other side to your blood product. Most standard blood tubing does have a micron filter in it, and blood products typically need this micron filter when administering them. So just double check that your hospital's blood tubing has this micron filter. Once you have this all primed and set up and ready, you're going to want to make sure you have good peripheral IV access, or if you have a central line, that's great as well. Typically, we prefer 20 gauge IVs or larger for administering blood. And when you go to actually start your blood product, you're going to want to administer the first 50 cc's or so over about 15 minutes. I've seen that time vary, but essentially that first 15 minutes, you're going to want to administer a smaller amount of the blood products because you're looking out to see if the patient has any transfusion reactions. And most transfusion reactions occur within that first 15 minutes. Not to say that transfusion reactions can't occur outside of that window, but that first 15 minutes is when you're going to want to have eyes on the patient. I'll usually program the first 50 cc's to go at like 200 milliliters an hour, which is 50 cc's over 15 minutes. After that 15 minutes is up, you're going to check another set of vitals, make sure everything looks okay. And if everything is looking okay, I like to increase the rate on my blood product if the patient's going to tolerate it. If they don't need it administered super fast, I'll just leave it at a slower rate. Most blood products need to be administered within a 4-hour window. This blood tubing expires after 4 hours. Once the blood product is all administered, you're going to flush the line with some normal saline to give all the product to the patient, and then go ahead and check another set of vitals to make sure everything's looking good. You're going to dispose of this tubing and your blood product bag in your biohazard. At least that's how it is at most hospitals. You're, of course, going to want to finish up your documentation, make sure everything's signed, squared away, and documented in your electronic charting as well. And that's all the basics on blood product administration. Let me know if you want specifics on different types of blood products or if you have any questions.